Unyame wahyehyɛ ne nneɛma bi sɛ yɛwo yɛn ne yɛba wiase a ɛfi yɛn nkwala ase a kɔsi sɛ yɛbɛwu afi asase so no yɛnhwɛ sɛ nsatea wɔ hɔ nyinaa no ɛnyɛ pɛ enti kwan a yɛbɛfa so na yɛagye atom sɛ ɛnam sɛ nsatea nyinaa nyɛ pɛ no nneɛma bi wɔ hɔ a yɛn nyinaa ɛyɛ sɛ kɔma yɛn na ɛno ɛna woka ne nyinaa bom a yɛfrɛ no sɛ framework a ɛboa ma nipa a yɛaba wiase nyinaa no ɛkɔ ma yɛn pɛpɛɛpɛ ma menkyerɛkyerɛ mu kakra osikani yare ohiani yare obubuafo yare ne friend ni yare untimi nka sɛ sikafo nko na yare a enko hospital ne ntadro mo sɛ wokɔ na wokɔ to paracetamol sɛ uti oya yemusa sɛ dan dodo sɛn ɛna wo meboa ɛna yemusa wo sɛ ebia sɛbia usika dodo sɛn na wo yɛka kyerɛ sɛ uti na yɛ oya wadro ni konom na ho bɛtɔ deɛ nwanwa paa ne sɛ ebia na nipa no mpo no wobenya mpo a na sɛdeɛ wɔ how no tete te sɛ obi a wɔyɛ amrɔba anaasɛ bibisa ka weka sɛ na wei deɛ ɔyare deɛ a yɛwɔ no kwan na wɔngu so ate aseɛ but ɛno ne social protection no right to life the number 2 say right to self determination sɛbi tafrakyɛ yɛn nyinaa ne yɛwadeɛ wɔ yɛn so a yɛpɛ sɛ yɛyɛ nanso yɛbɛtumi ayɛ na ayɛ a na yɛsɛ nhyehyɛeɛ bi wɔ hɔ ma yɛn a ɛda apon so ne timi ma yɛn nyinaa yɛyɛ ne saa na yɛyɛ memma wansoso yɛ baako te sɛ meyɛ bubuani meyɛ bubuani Wontumi TV program yi mame AGYEI program yi me wasɛm bi a me pɛsɛ me ka pa ɛboa ma me ti me ka na mame AGYEI pɛsɛ o ma me ba me yebubu ani no mame AGYEI kɛ sɛ ohwɛ sɛ metimi afo steps I wa ha ba o so there be steps de wontimi mfo enti e be lift amount so ho no wetimi aba ha be ka wasɛm si anya ne sa ne ya amwa me ka wasɛm a we have not more right to self determination like can once it is an your man kitten sa any aka ni nyina boom and I social protection na yeah and I'm say any no edoso nti yeah obroni besia say ya cluster no into 9 areas it any time ya ka social protection ya wo dwumakuo kese bia ya fa na International Labour Organization omo na befa ne se esi omo 9 pon so pa so be hwe se ebi na omo aboa me ahyehye no ewo eku enkono die dikan eye obroni se child and family benefits enkwala ene omo awofo ensunsu anso a eboa wom maternity protection say mama wo hey maternity dey say kan ye wodi mu a say be ye na obi kɔ awo so wanyem efida sabi tafrache either say okunyin seye kosi da obewo no kwan a efa so a ye hwɛ no unemployment support enyo bia na sabi tafrache owe bebu ana se pani a na battery sisine na so asabi atafrache owo adwuma na woni adwuma kwan be na eboa so ena omo wo adwuma no nso employment injury benefit si ye wa hai bibia sia atoyen ya atoyen nchama sia a ye wo adwuma mu a ye ntimi nya adwuma mfa sika ma ye ho ne ntimi ntimi ba kwan be ena sickness benefits se wo yare ewo krom so kwan ya fa so a ye hwe na wo so ho so enche bia se menim se maame wonem se obi bia fe no NHIS kra ewo krom ha eno ye social protection and your friend your health protection and no is clustered into medical care na dia one is there health protection no once me di kan aka no me can say maternity protection
yes
na over health protection na ye wo health protection na medical care general medical care
health protection no and maternity care doesn't fall under it.
It falls under it as well. Na me beka no me ye do komoko enimu a obi obi sasa dey ntina maternity protection kwa ye one to na ba health protection so a eba ehonom no. Na afi long term care. One say yare bi wo ho a enko.
Chronic.
O be ho to say blood pressure.
And diabetes.
Na diabetes. Long term care. And I feel old age benefits. And some your disability benefits.
Okay.
And now your survivors benefits. You can say survivors. Sevita fracture. Survivors benefits. No, o kana yes employers who kunafo widows and widowers benefits. But ne papa mu pa ne ye survivors benefit because sabi obi owo ebusuam or ka baby no ye obroni be say breadwinner na oni ho a omo wo ho na omo survive no kwan a ye fa so a itimi support na krom ha no to da bia ye ka survivor benefit na de odi chechiri mu ye very very simple ye say widow say ekunafo no to da bia omo asem ne yeka
survivor so dey o sha about say e ka say mo no could be a survivor obi a situation bi mo epie ti say bia obi a wanya accident epie bisa
no so ka ho pa to say but no ko injury no.
Oh, okay.
What you say until when you come to the ILO no omo framework ne omo assessment of survivors they really want to say omo target omo sebi na obi ene hwewom ena nipa kono efrimu anase nipa kono abeye incapacitated.
Okay.
But omo no still amano koma no na mami ama sa nioma we nyina no ena o kan nyina bom sede ye hyehye ma eyeyi wo kromo a ye friend of social protection. Na eno enso ye one of the core principles a war abefo the econo human rights enum na said ye ne hwe no tie no ntino ya makwan se o man bia nhwe kwan obefa so a sa ne o man kunu ya maka ho asem yi no ye be hyehye na ye kama intimiji se ne enkomo ye bedi yine baako ani ahwe bia Ghana ye Ghana jina
before say better say so that system of social protection do we have some in Ghana?
Come what other
me pa Yvonne a busa question so also me busa kwansani at was say do we really have it in Ghana that is working for us? Yeah, but why come on this? But person will answer we answer.
Question we yeah here and the problem about.
Yeah, what's the baha?
Yeah, what?
Okay.
Yeah, what the framework?
Okay.
Yeah, what the framework no? Because your framework na you want say na wo apon so no.
Apon so.
Say no. Wo apon so you woni nyina.
Okay.
Sika ye de bi pia no na ka de e na holding. Enti yeni na kande na ye de bi pia no nti no. Eya na ya hwe de e ha adwen kese pa nanka ya boa kakra. Enti obroni be say o say it is in pockets. Eye enenye joined up. Okay. As I say, very in patches and disjointed. Me hwani twi no che say napo ne bi wo ho a yehwe ne yetime boa bebi wo ho nso a fa me kono eni ho ni ntino and
what does it entail for it to be like implement?
Okay, the kind for example ye wo health yinti ye narrow say me say yankono enti yen hwe health part no medical care maternity care ne long term care no yen hwe e ho asem nanka yenka say kane papa mu pa papa mu ni e wosika wo ho a enka ye fra bibi needs assessment. Okay. Mama em say o nursing kakra o ye ne o public health kakra o ye dey needs assessment o better dey make clear say.
Say you me for na o catch
any ahwefo so say bia no abo no ya kirem. Say ka ye enam say kro bia ne babia yete no. Ye nipa nanso ye babia ye wo no eye unique to us no. Yes, a key, yes, say, yes, for so pay the papa mupa na for every 300,000 population. No, a child demarcation, ni pado do ni do a mpem ahasa 300,000. Yes, yes, near show yare wa a woho that community. Ne ya hwe kwan a ye be prevent yare no. Ene omunso a omunya bi no ye be manage ana say ye be cure for every 300,000 population. Case ye strategic needs assessment. It ye ya na say e bia every stadium actually he ya kwa kudu ebi odu ana say emfa ye ninhwa kwa kudu twemaso kwa hai kwa kudu maybe swami. It's nipa to do a why and also pa yenya constituency by constituency. Nipa to do a why. And you must say ena ebia obesity emu be 20%. Eye emu chepo edu no. See e katwi nti. Eye omo a omo mu odu nti omeduane die no is also biana mu odu is linked to maybe diabetes and hypertension. Emu chepo du eye omu ni omu ye bubuafo. Emu chepo say eye omu a ebia omu wo kidney any liver condition. Ebi mu chefa say eye omu a omu ye mabu a omu betimi anyinsan awo. Emu chepo say eye adwuma say ya omu ye adwuma wo baby omu ye adwuma no this accident betimi happen. What's the sensor needs assessment for that 300,000 cluster now? Now what the whole say abaho inti unim say so be pe nipa dodo na eyo obese no and now omo likely hypertension black you know and who say ye who adro and who is easy to identify and to find here. And a health promotion be promoting is targeted. And now you say much for eduno intimate disability access. Ewa henna. And sir.
Me study with the intimate consultant.
Debbie, and can say.
Oh God. Say your work can also strategic me because
well
a woman doctor a woman didn't see a bit to me sir.
Oh yeah, but see free baby, ye free baby near do baby. Emre bi ane wo ho no ne wo cash and carry. Yes we yare na on this car any onu nyame ya.
But about health insurance, no, your insurance, no, meaning so you always say it's directed towards only a curative the same in kitchen say obi yare oba hospital na behwe no. Preventive aspect no is not part. And my reading yama bebe amount for pushy I think say recently cry no one minister mentioned yesterday they should like address that say the preventive part should be added to the insurance so that obetimi sorry say oko hospital akwa screening the insurance not take care of but this is a situation that is not part unless say you are in a wako into yanka system that doesn't support your friends the preventive health. It's better you get the working. The okay is extreme. Extreme.
Yeah, the master na yate ase na say.
Okay.
But if we say wabomu ene chere wado.
Okay.
So kura social protection no omo ewo enimo no. The ma wodi hunu pa ye We say social protection, medical can say a right to life and then self-determination.
Okay.
The first thing in the life, no, say we won't qua. Into crowd social protection, a wohopan, life expectancy is high.
Yes.
That is the first way or the measure say, crowing the social protection at the same. The impact of social protection on the people. Life expectancy is high. Into our teacher, I say, about 20 years ago, life expectancy in Ghana was 52.
You said it was 70.
There be. So you do 62.
Oh, okay.
Into what it is, they say, and now see a dent to say be a guyapo montino. In the last 20 years, Yetimia raises averagely nipa ewuno. And son of Uno, no dear Ducia in Embieno. In 2 couples, I kept 2 years, as I say. Waka.
But what they should say, current.
Yes.
Okay.
That is young, but a lot of people ever called before. And I've been so obedient how because individuals can actually also boost their own protection. Now, or much, but and no social protection, and no a narrow view of one casa show. But the society now a woman now, yes, a young say, and may na so yes can you so you hear new or them. So call a monane any baby. There's life expectancy no a year na a wasro. Inti say life expectancy is 62. Now you see, I just say answer now be 62 no. Say nyame be frewa. Esi you causation the ekunwo mpacha what you say na ye postmortem and na say the risk be wo ho a ebetimi akoso na mu te say the ya kwan tie and say the car driving tie no na ya ban hye so be ye no stringent say the likelihood so be benya accident and if there is accident therefore no will be very minimal. It will call Krubia, the stream example, na me the basic example. To call baby to say Singapore, which is a society that has a very good system now. If every could do life expectancy was like 93. Until be could do 100, if we could say, wouldn't say nipa India, won't be Oba Britain 85. So, Oba Ghana, na make us say Yakoye ni makudusa. Uko baby also almost much. But so person who said the social protection, your health, for example, it manages in her. And I make a choice a case yes assessment no. Inti na mamen kansam ba ko ekoso Ghana. Is a big social protection matter. Okay. And crofon ka ho asem. Say be long-term sickness care. A year diseases for liver and kidney. Yeah. Me pa just what you say sir. Because I say ya nye social protection ho adwuma for the last 20 years wo baby. And this is our problem naba. Because those kind of diseases now 9 out of 10 a lifestyle diseases. Me pa just what you say. Yeah. Yarea ye bibi na ekofa na deba. It is the first part and now can say preventative no. Your national health insurance no. Any your Ministry of Health. Any health promotion directorate or Ghana Health Services. They should identify strategically continuously and new ma ebetimi the lifestyle conditions about the kidney. Yes sir, yare ne ba ehunka to cure. It's very expensive to cure or manage than to prevent. Mpacho what you say? And sanom bebre e wo krum ha. Yeah. Na say ba ku bi abanse e friend shisha.
Ah, shisha.
Yeah. Ba ku bi a friend shisha.
Shisha.
Eduane.
Ma no call your name the case.
Oh. It's here ka ya po modin ho asem. Social protection say okay. And sanom bebre. Shisha. Afi edro a ye wo bottle mu a bibidro a ye hye ya ye ton ya ma ye bibidro bebre
quantity dosage wo say ye fe
bebre tatahwe ya mu gira bars no so we tatahwe enkun ye so de asra wo ye say we sa nyoma ni nyira no items a eno no yan regulating yie pa anti no na ye manage ni yie no anti no ye na de yare breye ya ansa ne akasa aban no nkofa yemfa we nse
recently the okay friend say dialysis machine ye ho abase but kwesi up to now still omunye ho ejuma po and ye blame more amount for meanwhile no the condition that they buy no so igina yanka say so
the enti amani omo blame aban ya adwene and they say if you don't put the mechanisms there to prevent her so ne ba you have to deal with it.
There's that Ministry of Health now and the Ghana Health Service no and your more health promotion units no they be American I think some one lead the be war a class ya na me also me attack no but some you say a day na a ya na or more is it about organizing summits conferences and then holding the also they be stakeholders no and that's coming down to our level no say a war facilities no to come and educate use the social media to go and educate
the
upper concept cementias but I don't know
she nipa nyankopon boy naturally yaso de
okay
di nyankopon boy no on say omom ye Christopher no o Bible mu Adam enne na yire Eve ayebo ma o no di asasi nyina mom di bibia ma o ene o ka tese munni we nyina we
so munni no mu
we fa o sanka ye bae no northern inside dey aka ti nipa ye wo ho no yaso we are naturally self-centered said ye beye ma ye ni aginko a o kina be kunyan kura na enne sa na yete enti eye ya said enti ne ye wo akola ye tete no na ye fa be lifelong learning entity no eni awie mami ama onime wa hey bibi wo kwa da bia esi etu ye hofo ho si ye ntu ye hofo ho a ye ba koto enti Ministry of Health asemu a wo okay di bia me ne wo ya adwene and they say omo have to be clear about omo health promotion mechanisms because eno beboa then but enyo omo nko a your department bi wo ho a gender children and then social protection na ya ye ka yes bia ya hwe kunafo ne user one who said they have a whole omo nanka health promotion asema ye ka because if these are
but there is a whole department for that too.
That's what I'm saying. They have to be able to be working interface because oko health education and labor omo joint committee on social protection omo nyina ye adwuma bo but yes yet me identify a neoma high on komo ya na media say o man bi so a mpacho tie ni ba because they want to prove their social protection omo ntwen senkrofo nyare ansani akase ye pe dialysis machine omo be categorize ade no into miensa omo a ye from control group tese sankrofo we mu enne ye be ye adesua omo a ye be ka chom so omo ye giveaway group omo de omo atrapo omo atrobro ni be friend say be careful enne omo afei na omo ba mpacho what you say inti ye be kire enkwala afei na omo ba before the age of 16 no health promotion through curriculum and education akachire omo say saadie we oya adie we na de bebro because the best form of promotion is providing information that allow the person to make an informed decision. That's the first bit. The control group no ma shemra says nam no there also back away but nam na akwa na tax that because wo be yare shesha na wo kodo no also be no but the whole tax that so what I say because wo be yare o yare a enu bi ne de behwe nti we have to impose high taxes on those particular na size kana wo beje no you direct it towards the management of that condition. Me pancho what I say enya fe ne ye koje bosian ne de akoto dialysis machine the wonom sesha no otua twice the price baako ekọ yo ye sesha no na baako akọ ne yare o be yare daache me pancho what I say
na fi baby omunum ne aban ho anamanfo no na
na make can say you have to regulate say crofo bebre wo baby a friend pork joint for example anajo who could eat that level of fat ya toto unim say it has to even pork has to be cooked to a certain level of to manage it. Now we could not we any buy okay, but we have to ensure say wo kokun hu sa no oba beda hospital nti ya assessing o area ha ehun say e doors won ha pa as part of a strategic assessment ni ahwe hu kwan a ye de befa so nti ya anya no sa no de a ene ya kan de no yenya e be che kakra because yenya ya dwen say ye be jai sa ne o ma ne ye. And so you see, I buy alpha dialysis, for example, and a national insurance. That and no crying your problem. See, I did dialysis machine, no crying your problem. But actually, the workforce now, every year juma, na edisikabo menu no. Munina mo yarea. A bay day na why I juma. Mpacho what they make sense. So. In terms of those assessment, and no, and I say, yeah, prove it. My main question, I know, and I said, do we have it here? No, we do in terms of structure, but in terms of akandia, yeah, the bekono, and na aka.
The time, no, community also be brave. Time the same. Sample 343. Okay, okay. So, what is the concept of protection in health and social care?
Okay. So the concept, in protection in health and social care, is to achieve 3 objectives. Okay. The conceptual framework is designed to achieve 3 objectives.
Okay.
1, reduce poverty.
Okay.
2, improve livelihood and life condition. And 3, improve well-being. Me pacho the kind say ye bete ohia so ohia nye na so beka so bi to ohia so anya sa wo discussion ne botom kwa keke time abehu se wo ye ohia ni ye time a bibia ye wo unyamoa me pa cho wo ti ase se wo ma miensa te se abroche me mfa de se yankrofo ka benefit to abroche wo ma na sabi ukun aja ho okọ na yeah aban say okay because say menti ye be ma kwan bibi kakra o de beto aduane adi enye kese bia de but enam say no wo ho nti no utimi nya bibi o ti ye be ma ba bia tra ne ama ba bia tra say de wonye homeless eti eno no ema hu ohia no how it impact on you me fa cho what you say and improve livelihood no yes say ya can be to say your health systems should be say a bit me aboy. Your health system should be say ekukuyen. What I say? Now fe your social systems no say a boy. Into sa livelihood no any hu eye ade a akakakra wo yekrum ha. Okay. Yenya bread dache fufra ye be fa baako said the kind particularly on the areas of health na long-term health management and ni aka ho asem and then the well-being na ni aka ho asem no say sabi ezi timidi ye nipa de oba na wantimi eniye na okwa wa makura akeye what I say na say ye bitimi edi ye no eni say ye be hwe eniome ya ye kan ye hu bi na ama yetimi abo yen ankasa ye ho ban ye ma ye ho ban na ama yen so yetimi enyina che kakra. And that for me is the concept of social protection.
Okay, so what's the difference between protection and safeguarding?
We busa some kese pa. Protection no say enyoma yedi gu apon so a eboayen.
Okay.
Inti said ye can your policies, our programs, our framework, any but individually no. There are ways that you're regulating.
Okay.
What you say? Inti for example, say krumha ye wo enkwala protection ye dia mom say so munya education. Yes so mu ye enkwala ye mfa o mu nkoye adwuma. So mu ye enkwala omutimi express themselves. And yes enkwala o maame no mo. Yeah, what Children's Act we have to provide a mechanisms to regulate to ensure say it's happening.
Okay.
And no any safeguarding regulations are yet better. Inti sebi odi akola ekoye a year your friend say juma as a child labor na social you for social services for department for social welfare for ako say ukobo yira na for our they are providing the safeguarding mechanism to ensure say the protection systems na dey go hono eboa. If you go into health for example you see young men come maternity for example. Okay. The reason we have midwives for example is to ensure say akwala no fees ye be wo no any say yes no ayekama. Then can you wuska kakra your health visitors I be when say nkwala no wo ho no mo mu fia and no your public health you can make sure say you are near moody near omoyi na yekona wa anye ne year then you safeguard you prevent them from dying you prevent also say a right to life mutane wo ho kese fa yawe sa magana yakoya ni fa what I say so safeguarding is preventing the risks associated with it. So if you put the protection systems in place, then you put a safeguarding regulations there to prevent the risk. Some catch you say yeah so day. Into one so that is the one is the framework and the other one is the regulations that protect the risk from it happening.
Okay, so the universal social security and social safety law nets are they the same?
Me pacho and no on say language idea be interesting.
Okay.
Tete no you need a friend social protection any friend social security no.
Okay.
Mpacho what I say. It's here and conformi and then they what busa sem na menka. When we see you will be a friend
SNET, yes.
You boni nyina dey say. Social security and national insurance trust.
We come to some of we born him.
What is it? Yeah. What is it? It's SNET na wo ho no. For your social security and sana national insurance trust. It's the purpose of sana yenhye no say no. Social protection and na social security. Inti no baby to say no. Two functions. Insurance no. And social security no.
Okay.
Inti the social security no yes be strategic assessment here ye ken. Ni ya gina so ni say aha. Say ni be kwanso a ye be boa mo through an insurance policy.
Okay.
And I say aha say ni be ye no ka yes okay ye ka say health I can say dialysis no my needs assessment almost say nipa group way so insurance premium bia o yare a you betimi dey ahwe so social protection actually is social security na ye krom no ye slogan say you musase What is it? It's a obi timu say na social protection creba Ghana da be. If you have a croma verso. What is it? So it's the social security. So one can say your right to life and self-determination. I don't know social security no. What is it? Na tete no. Na ehunu say ye niska bia da baby a se bitafrache ye kwatam de amount na sem to wa. Enti nam se wo ye adwuma nti ne ye fa say right to life nti ye tetu sika kakra de ato ho.
No.
Na de nim so
consent. I'm not say because wo ye adwuma nti no. Whether you like it or not, I will say until.
Me cry them a problem kese wo ho me nuaba. Problem wo won say ye cash senator ye say pension. Me boa.
Yeah.
Say ye cash senator.
Yeah.
So unya taste senator at the end about trim.
A pension ko pensioner.
No akwaje. But that is not the purpose of social security and national insurance trust.
But
you see there's a pension act
in it.
I just say and I'm say ubusa me say sebita fracture. Also catch me say social protection you will be okrom ha. And I'm catch we say e bi die e wa ha na kade no ho na aka si yenkeka asem na wan hwe na wo cheche musa na wan hwe na obi aka che so ya anti government or anti establishment anti this anti that because yenye krom ha that yenye krom ha no opese who educate na who advocate no it becomes politicized it kaye yare ya yewu what I say sabita frache a part of a social protection say for every cluster of 100,000 people there should be a well-classed equipped trauma unit there so trauma unit say emergency medicine for every nipa aha empemo ha bia no
say dey na confanochi
me pacho take confanochi o ba confanochi for every kaya we have to it was like an ambulance I here no
here crabby
na say
but say bia yintimi nye something ye ambulance to improvise
but the ambulance na ya no what the trauma unit no what is the distance from the trauma unit and again see be any year pa na from the trauma unit no and the cluster of places na nipa no one averagely to get somebody into the trauma unit shouldn't take you more than 10 minutes.
But I think say no something dey bia aban net na ase a omo dwen hu se wo se omo ye agenda 111 no ana wo hu
mejidi but and also can say yes but what I'm trying to say is say you wo baby bebraye ko I'm saying we've made progress say na me baye no kra maka che no say some 20 years ago now we be once and our pension time aso me fa what you say 20 years later ubedi 2 years AGYEI and san our pension and so countries on social protection no a year improved no what has happened is that their life expectancy now kosoro into ko ba bi ti say Britain and na ye be kan ho asem ye ye mo se da bi mu ya mamo nko pension 60 bio ye dem ko 65 ye dem ko 69 because mu nyina na mu nyini mu nya djuma bi nkan because we are providing a lot of amount sika ye tete yen for national health insurance sika ye tete yen for snita now ka obeka say is it supposed to be compulsory yes we dem dey compulsory so dem da ba ya
and the ampa
mpacho what I say so nim da ba yare it will nim da ba yare ni ntino see you see bibi to homa because you the manwa say wo afa koto ho a say na dey say baby bebre wo ho a ye wo obetimi aye private pension obetimi aye private insurance hospitals bebre okrum ha obetimi akoye wo private servita fracture we said ni pado do say no aye na agent say obakoye private insurance.
It's coming.
A fair neighbor. And always the state has a duty in terms of its state directory principle to protect you. On Article 36, it is state is taking its duty seriously.
Don't say only mostly government workers, private owned workers. No, hardly and I say kakrebi na social security ma wo.
So
it's also no.
So and also no. eya asemo a te se baby ohwa your friend automatic enrollment so once a krum ha wo fa wo bia adwuma eso kutia net whether it's government or not
sir eh adwuma sir
there be say make asem na make asem na ye kan ye keye se wo ho any ho
okay
enti eye yenso aye wa ha ya said yes service wo call employment place no be fa wo adwuma utimi ka kire nipa ne se me pa cho tia mesnet mame
okay
na bibi ba metimi accord mensa na ma ye but say kra no more to do with pension than the total social security yes say
ka ho no bi me time no cry also you say it is net no enye for pension alone
it was not meant to be say there
say there zani entiasia na say
say but the concept of social security and national insurance trust was a whole comprehensive social protection and its corresponding insurance.
Yeah.
Said ye beya. You share to said ye share 9 areas of social protection here. Nanka ya share kwanya ye be faswa.
Because I think say a couple of is it months ago ye nye bi sokrada obe share ebia health worker.
Yes.
Or yare.
Yes.
Waye ejuma obi ye ejuma 20 years be ejuma more than that.
Yes.
Na ye jijiska e we bia platform so say yemfa ensa ne yare.
Yes.
Enti no sa social protection no and social security no e wo hefa
menu aba na sabita frache yen ko yenim nkodu baby a ebeya si e kasa ansem we ya yemfa nye politics
okay
ade ba ko ade ba ko a ehu pa ne to politicize health and social protection
yeah
o yana sa unhu no krewo
okay
no crab ka yesa wom asem we mu pa na say yesa ye busa ye ho say does at the systems na is designed to look after us ehwe social protection okay and if it's not moyen ha adentina moyen enya aban say
why na wo so onhwe so
ka opani papa mu pa ya de ya na ka me pese ka me hu ne say ka first and foremost yes ye share independent advocacy groups are
okay
omo asede ne say omo be assess independently
okay
the progress we are making in the areas of social protection
okay
na no kre wom ne say me ne enkrofo bi edin komo because there be awoka na wo anye bia emfaso ne so enti emfina nko na wi na de na me ne enkrofo bi etimi akabom to outdoor a social protection institute ewo Ghana ye beye no independent non-partisan bring all government agencies on board and also make sure that there's always a seat for obia or health mu depending on government abebia and obia or social protection mu na free aben mu team aben bi abebia to make an independent assessment with the view say I had the touch makakra yen koyenim kakra because they say the hamititru ne say the emerging sickness what you say eba yesu wiasem ha eba yesu ewo Ghana ha you need the corresponding equipment and treatment
20 years kwa di bejan because okay she shamen sam no ne ma ya koso ha mum say ya
the bomi hu pa kese ene the disaster emabun ne mrante kayesom ye able body they will fall within the trap of health long-term health care obeye incapacitated so munni ahoden ene sinta krono emabun no ese eye adwuma na timi de boa oman na oman ne nyesika no so munyina no efan yare why ebe ye adwuma no na oman no ayede ayeye na eno na me feel say ka Ministry of Health, Ministry of Employment and Labor Relations, Gender, Children, Social Protection. Can say your dadwin debia say, what are we going to do to improve social protection in this area of health? In making sure say the kind baby I see a regulating no, you regulated the tossing you know the emerging health conditions are able no. Quite a bit faster, a bit powerful corresponding treatment, equipment, and management. Now, Faye, Yahweh, near who say the generation knows now, Ebano, a bit me and navigated them outside that path with a new curriculum that teaches them to move away from that. And no, and now, just say, a hammy, because I that drink. Enche ye bia na me fi broni krom amanone Britain by ye wadro bia bi wo ho banya yare bia na ebetimi aso ano mpacho wote ase enti ade ba akọ aban na adwene ho a wo ye ne se hwe sese ye mankwala wadi first ne se ka wudi 16 a untimi entonsa ene ye de ko 18 ye sese ye de ko 21 opompo ye shemra yes ye makwala bia wadi less than 21 enom sa. Oh, I'm so crying, but we're going to say, if I'm going to render all my able-bodied workforce not sicker, how am I going to?
It's all about politics. Oh. And you may be one country in the we don't talk about it.
Because say we yare baby o pese o ko konfanoche anase o pese wo ko eyi do be some say yare ben na eba wa ebo mo katitiriwa is mostly lifestyle diseases. Wonim de enti ebo mo katitiriwa some pana ne pana o daso no empano if you want to calculate health and finance na every day I would damn person it cost the nation me ba jo ati say it's what begina to yes o NHIS nyame aboa wa begina beto but it cost the nation a lot of money now, to keep you.
Last month, a friend said breast cancer awareness month.
No correct.
You say na mammogram class they say ma omonya 40 years say corona. But could you believe say men she I think say screening ma over 500. Or more I suspected say lamp no and I say omo yenya cancer no. Or more 20 to 30 or more even like per the guidelines no. Or more to me call mammogram. But meanwhile they have to go and do it and confirmation of the whole mammogram kwebi ni hono mammogram machine yo so ye kwa na se ye ba
waka baako
so waka baako
abe kam yenu ntoso
kaso
mumma ye amopa ho fe
kaso
me ya amopa ho fe musi afa bibi ho section musi afa bibi we section musi mu akɔhye we kakra wa ha akɔhye
memma na emma maye
sa we pa jo sa eno Emma wa ho ofani ba sesi a but unim say our lifetime health implications unim say eni ho akade o say
omo kwen no munim but say ka share mo alaka share
na me say your whole long term health implication it is onipa no o yesa ade na o yare wo krom hanti a yesa eye ya sede say ye hwe no nti me madwene mu no we should be able to say ye beji genetic bi ato omo ye no na dachi
omo ye sa o like ye omo ye bebre
omo ye bebre ye genetic bi to no yare aye de ahwe no
omo koye no
ye genetic bi
to obi ye bia na genetic
because you see there are things that we cannot fund.
Okay,
what is it? One of the things that in social protection, you cannot fund is individuals' personal choice.
Okay.
But what does that make us say? See, you know, you see a faha a year. And you catch yourself on Kwafaha or Becow. Was a Hanamefa.
Okay.
Or Wakame was my drone and find some hoyare. That's not social protection.
Okay.
social protection is yen nyina na esi e fa na wo be ka ye wa.
Population.
So we should be able to agree what universally. Ye behwe na eba na towa ya hwew. E don't need ye NHIS say yare we wo de a. Yetimi yo. Sense na say oh yamfa bibi foforo nka ho. Me table no ho na me ye debate. Me say is this lifestyle choice government induced, public induced, or individual personal choice?
Okay.
Where is an individual personal choice? No? You can't institute social protection mechanism to protect that individual personal choice. You are going to cost the nation. So yes, to be able to provide, we have to provide a state responsibility, but you have to pay for it.
But sometimes when you inform that we be or we say we said
enna menne wo any obi a odi kan kan na adwen say because at the quality of health promotion, advocacy, education, and information you put, the state becomes directly responsible for the sickness of the person due to lack of information. For the incapacity of that person due to lack of information. Because if you actively do health promotion, cervical dialysis, kidney assembly, can come will be that is it about time to ban smoking in this country? Because Britain has banned smoking. It will cut cigarette and no work over show respiratory condition. So is it the point is that but enam say yentimi health promotion into the debate is not on the lifestyle choices. The debate is rather on say you need enough dialysis machine.
A whole division for health promotion.
If I try, I know the other airport, I know how many politicians. The
politicians will do it.
I am saying the we city memo for have a duty. Say your per se your health, and your well-being, you're promoted, protected.
You make us when they are informed that we put one money because your team ain't share ye jume. The BIA or honor, but one couldn't quite screen more than 20. By bet set TV so I can't hear quite 30 some 14. They came and scream more than 500 people. And to say advocacy or honor, they will come.
I heard yes, I know I are say touchma.
It's not make us.
I wouldn't know I are say a touchma. A touchment in a Yabu 62.
Also, the politics say it's not politics, but once you have a division for health promotion, they should make sure say they are really promoting health. That's what I'm saying.
You any a director for health promotion, a friend of Dr. Da Costa Abuaje. So who tia we pacho. You say improve health promotion. Na yare for
it shouldn't be always stakeholders. Not stakeholders. Not they will just invite donor. Your friend say most of your friends say partnership people no for conferences and they should just come down and do the health promotion. Is it always about the stakeholders, Mr. I don't understand. I want to meet TV program no. Your Star Health Talk. Okay, I'm doing the AMPOFO. Mr. Andy Owusu and the Nation Komono. Social protection consultants. Ben Ghana House, so over Ghana House. You're training him. But my last way is like I'm wrapping up a time.
Yo, my last way, son, say, Didikai, my boy, Abba in the last 20 years, Abaso, from 1992 to 2022. The year when they say, ye check, Ghana. So we are growing. Our life expectancies now has improved. Inti eno mebona baso na masadi adesredi atonenim say bempese minua babe 62 because he has we 62 as ampa internationally World Health Organization aka say ampa 62 awe with the natural causes me pese unyini ekonanim kodi 85 90 100 but not just say yes say a day social protection mechanisms no frameworks in the system na see improve na beba na koba say to yen chambia ni ugu a friend preventative deaths no ebi ameto yen nti adesrede amese ne se enne de titiru pa ye de agina so ne se enkomo ya ye twetwen ye de ye hunu pa ne se we have to improve on preventative health.
Yes.
Preventative health ne say ye bo ho ban ne kokko said ye wonko yare.
Yeah.
And no enso ena obroni say that is the core part of health.
Yes.
And well-being. The akana de clinical why yare any ye hwewo. Ena ye hwe ya manage you kusise ubewu with medicine. Into a new emerging lifestyle na ekoso ewu krum ha no. Chere say yes ye ma ye home ne so near prevent a lot of avoidable health conditions eba the hamekese ye kidney and liver conditions if one kasa kra wo sika obetimi de ahwa the yare no said ye how ye one kasa and then the people around you said ye more madwene mo ye no mo ye basa no please ye mokoko let's advocate and yes say ye dwene ho say oh wanya enti ye dialysis onyame nshra ye nyina na mejidi se mebabio no na ye kwa 64 me das
oh that's saying ke jaya ke betu chen komo ipa ma na kwachi so many questions on my yentimi embusa Mr. Ndiama na enyi ano komo to chen so e den sem ho no wo senke address by time no entimi amma kwa hope say let's take it here
possible I'm sure say 9 areas no ya be fa no baako ma baba kan insurance ho asem ofie hada e wo Wontumi radio okene ba Thomas okene ba Siedu ada romanti ma be kan insurance afi me be kan maternity ene nkwala ho asem a eno me say Dr. Patrick Kumabu ajaye ne de pa na ofrefre enti ya start the American say ye be Wontumi hada me fie ni ti meba bio na me no be kasa but the woman ni so ne say ebre ne so na me pese me de to ho say ye pese ye social protection advocacy na munyina mmeta echi na enye kama ya me sure
so my very good information I think say submission is very knowledgeable it's you know ye be ba ya be support na ya ka social protection ho ye ho sem de bebrebe ya kasa na is a midwife for your issues bebrebe wo ho about deductions I think so see nya bebrebe yes I dey probi organ ha mai no mbo opa ya best your issues bebrebe na foforo ye be say she aha Wontumi TV na se be nkoma me production here Mr. Bosheba na Mr. Ima and me ba Ivona Hene so ba hanom say and makeup artist Pretty Sharifa me na se bebrebe AGYEI designs AGYEI designs me das and then ladies fashion hub so na share matare aha Wontumi TV program no Star Health Talk ye wie ubetimi akọ on Facebook and see YouTube ubenya ye honom no asa ahye that's yemi admonesty ke oha